Because the knee pain is always on the inside, correct?
Oh, yeah.
Okay.
Just right as you're rubbing.
Does it go through the joint? Does it feel like the joint's unstable?
No.
Okay, so it's only on this side.
Right.
All right. Did you have an X-ray on this one?
A long time ago, yeah. Not recently.
Okay. I want you to take all your weight, put it right here. Get your knee at 90 degrees, pull the heel back just a little bit, and lean on that. Hold it down, and now I'm going to come back along this line. It's okay.
It's sensitive, but
Not super sharp.
Not
now
super.
take the weight off here, and you'll notice that it gets like
big,
really
big
hot.
time.
So go ahead and do that again. And what you're doing is basically squeezing some fluid out of the whole bursa in here. You're putting a mechanical receptor inside the joint, so it's responding to the weight. So that's basically what happens when you walk.
Right.
Okay. So we're gonna pump it. We're gonna go press, release. Slow.
Oh.
Push down and release. Just rhythmic. So get about 5 good contractions in there. Let's go 10 contractions because it's been going on for a while. All the way up. There you go. Get the full weight in there. Okay, ready? When you take your hand off, you're going to go back in here now. I'll check this inside.
Oh, yeah.
Okay. Now, if you look at the knee right here, you can see how much swelling there was.
Yeah.
How much you just
the
compressed.
indentation.
Yeah.
Oh, yeah. That's
Tremendous.
really swollen.
Tremendous amount of swelling.
Yeah.
So part of what you're feeling is just the whole thing is expanded.
Yeah.
So you're getting that. You can see the depression they have.
Yeah, I can.
Okay. There you go. That way you have your body over it. So now what you're doing is you're mimicking basically a walk. Get some pressure. All swelling of the knee is going to go northward. It's not going to go down. It can't get past this capsule down here. Full weight. Full weight up. Yeah, back it up. That's better. Full weight. There you go. Okay, now check again. It comes down.
Oh, yeah.
But it's not going to stay, obviously.
No.
Look at the swelling.
Yeah, look how much.
Big
Let's
depression.
see that.
So that depression right there is swelling inside what they call a patellar bursa right there.
Wow.
Okay.
I mean, I could look this up even more.
Okay. 2 fingers again over here. You're going to be right on the bursa. You should find it. Start out here if you need to and come back.
Okay.
Right about there?
Yeah.
Okay. Take your hand, lay it just like this. Let your fingers just lay right in there. Perfect. Now, from this back of the heel, you should have a nice sore spot in that muscle.
Oh, yeah.
Okay, now there's your muscle. Take this hand away. Now, put this heel over here. The whole heel.
Oh, the whole heel. Okay.
Whole heel. Bring the leg out like a figure 4. So just put this heel here. No, on your shin.
Oh.
There you go. All right, just hold it there for a second. And then check this muscle.
Ooh.
Not coming down yet? Okay, bring it up a little bit higher then. Check it again.
Still tender.
Okay, bring it up just a touch higher and let it flop.
Better. Not nowhere near as sensitive.
Okay, so we're gonna go from here.
Okay.
We're gonna check and go back into the inside hamstring. Swing it around here.
Ooh.
Yeah, and pull it that way. And go north. Yeah.
Oh, yeah.
Good. So we have a spasm occurring, weakness, a strain of the. There's 3 muscles that come in here. That's this semimembranosus of the hamstring group. Sartorius, gracilis comes across, and then the semimembranosus.
Yeah, right there.
If I gather that up, that feels good.
Yeah,
You feel
it
I'm
does.
squeezing all the juice out of it right there.
Yeah, you
I
do.
just got the whole bursa. That feels good.
Oh, yeah. Much better.
Yeah. It's a lot. So what happens is the bursas swell up like a balloon. The first time it's hard, and the second time it's easy to blow up the balloon. 3rd time, 4th time, 5th time. So the balloons are just swollen.
Yeah.
And they're in between the bone and the muscle. That's where the bursts are. Okay, ready?
Mm-hmm.
Put it back down. Good. That's
Yeah,
right. Check the line.
Yeah, you can see.
Mm-hmm.
I can see the swelling has gone down considerably. This was all up
So
down.
it can't go anywhere. It has to go this way and up the thigh.
Yeah.
Outside
So
and in.
pulls. Yeah.
Down and in. Now, bring your heel back over where you were. Bring it up. Kind of let it frog leg. You can go ahead and lay it right on me.
Okay.
2 fingers up here, right into that point. Right here.
Yeah.
Got it?
Yeah.
Okay, it should be tender right there. Right on the bone.
Yeah.
Okay, now we're going to trace that. Should be tender the whole way.
It is. Oh, but especially right in there.
Okay, and then that one comes right into this area of the knee. So what we're going to do is the same thing. Just have you do your little hacky sack move. And flop. There you go. Flop it. That way when you flop it, you're getting that sartorius muscle really good. Excellent. Let's see what the hamstring does after this. Okay. Foot down, pull the toe up. A little bit further forward. Now just dig down, like you're pulling the hamstring that way. You contract. Just pull your heel that way against the ground. Against the ground. No. Heel. Heel. There you go. Just pull against me. How about that? Does that hurt it now?
Not at all.
Not at all. Good. That's cool. We can try taping this down and get some of the swelling down. But every time you squat, the kneecap's going to run out this way.
Yeah.
Put your finger right here now. Now you feel where it's all, use your fingertips.
Oh, yeah.
Now it's all boggy.
Yeah, it's all
So,
mushy.
yeah, we just move some swelling around. The fluid in the knee needs to go northward. It only has one drain, and that's this one in the inside. That's
Yeah.
what you've been doing. Tender along that band.
Yeah.
You feel that big old knot right there.
Yeah.
So we'll strip that out, come back in, take this down just a touch.
Okay.
The vastus intermedialis, which is one of the quadriceps, is in the midline. And you find it just about a third of the way in here, right about there. Now straighten your leg, and you'll feel that one contract right there. Now, does that hurt over here?
No.
It's
Well,
fine.
it hurts down.
That's
here.
the hamstring doing
Yeah.
it, okay? So let me have this for a second. Let me take the weight off. Now you straighten it. Is that better or worse?
It's worse.
Okay, drop it down. Let's put some resistance on it. Now you're gonna push out against me.
That doesn't hurt.
Nice. Good job. Okay, relax. Come back up in here. Find that guy.
Oh, yeah, that's it right
Okay.
there.
Broad contact with your fingers, and I want you to just hold it down tight and pull that way. That way. Now push against me. You should feel that muscle tighten.
Oh, yeah.
How's that feel?
Doesn't hurt at all.
Nice. Perfect.
Wow.
Good job. It's your squat that just kills us, and you just really got to be careful on it.
Yeah, now it's starting to ring a little bit.
Okay,
Right?
that's
yeah.
enough. Release it. Go through some motion.
Ooh, ooh.
Go through motion.
Yeah, back to being sore.
Okay, push against me. Contract and pump. Okay, now put the leg down and do the same thing we did in the beginning where you put some weight right straight down. Just load it up, relax it, load it up, relax it. Then we'll finish the rest of the exam.
It's starting to move up now. Up in here.
Go ahead and go for a walk.
Okay. It's still a little sore, but nothing like it was.
Good.
Little bit here. It's got 2 points, like right here and right here.
On your back. Hit at this end.
Okay.
Anterior ligament inside the knee allows the forward and backward sliding. There's an anterior and a posterior. I tend to believe that they're intact. It's just a swelling that you've had going on for so long. I'm gonna sit on your foot.
Okay.
Okay. Right here, grab the eyes of the knee. One thumb on each side of the patellar tendon. My hands wrap around to the tibial plateau. And she's got movement. If I go backward, good. Medial, anterior, the anterior cruciate's a little loose, not bad. For that kind of swelling that's been going on, it's not that bad. You can feel that, right? You can feel a little bit of movement. Okay, turn loose here. I'm gonna hold the knee. I'm gonna hold it here, and I'm gonna test this ligament right here. Okay, I get right on the joint line from the eyes of the ligament, or the knee, slide right across, there's the joint line. The patella, the bursa wraps around. You can feel, you palpate down so you can feel it. Drop it. Now full extension, but I can push on the joint.
Right.
Okay, now you're feeling the upper area, right?
Right.
Okay, but you're not feeling joint line. I'm on the joint.
Yeah.
That's good pressure on the joint. Full lock. Turn loose. So we know that the joint is intact at that point.
Okay.
I didn't do the medial. I'll do the medial real quick, or the lateral. I'll go ahead and do the same thing. Nothing. That's good. If I do the fibular head, no big deal. Good. Now let me have the knee. The problem is that most people are doing their knee exams and they're trying to do it on a 32-inch table.
Right.
Up in the air. It's like climbing up on the counter in the kitchen.
Yeah.
You can't do that. You got to get down and close and personal. And as I rotate it in, that feels good. All kneecaps will go to the outside. They want to go this direction. This is pretty damn tight.
Yeah. Oh.
This knee did not feel like this one. This is the one you replaced, and
Right.
This one doesn't feel the same. Totally different. Woo! Feel that release right there. That release right there is one of the bursas behind the knee, and I'm right on the gastroc where it comes underneath. Yeah. This is why you got to elevate your leg way up in the sky.
Okay.
When you elevate it, it needs to be in the air that much.
Wow.
Now, you can point the toe, move the toe up and down, move it around. All those little activities can help train the leg. Okay?
My ankles click when I twist them, so I'll just go back and forth.
Whatever you want, whatever's comfortable. But the idea is you get a little movement with it up in the air.
Okay.
That makes all the difference. Drop down. We're going to go into the back of the knee. Just to turn this. Don't lose. There you go. Just let it go. There's some swelling in the right in the center bursa. Bend the knee for me. And you see, now you can see the puffiness. That's really puffy. Really, really loose. You can feel that. It feels kind of boggy, swollen. Compare that to this side over here. You don't feel that. It's all on the medial side. Turn loose. And then I'm going to come up into her hamstrings on the inside one. Bend the knee. Keep going until this pain goes away. Up there?
Yeah.
Pretty good, huh?
Oh, yeah.
Now that's the one that goes into the inside portion of the knee here.
Okay.
But you have to get that kind of contraction. Do it again. And then relax out of it. Don't let it down all the way. Keep tension. Excellent. Go again. Excellent. Go again. Yeah. Good job. Excellent. Good job. So that opened up real nice, and it helps us out. So we haven't got to the rest of the popliteus muscle here, but we're getting there. This one, the popliteus, comes down the inside, starts from back here on the back of the knee, wraps underneath, attaches along this band. You can feel where this band is tight, right there on that bone. So I'm gonna turn the foot in. Don't let me push the foot out. Keep it right there, okay?
Okay.
How's that feel now? It's okay.
Yeah, it doesn't, not too bad.
Now release it, and now you feel it right away. You feel that whole band come right back.
Oh yeah, wow.
So push into me. So the popliteus muscle's a little bit involved. So we're gonna come into this side, opposite. Take the Achilles. Yeah, her foot's rolling in. See how I can pull the tendon that way? I can pull it this way. Doesn't want to go too well, does it? Easy, hard. Feel the difference?
Yeah,
So it's,
very much so.
yeah, it wants to come in, keeping the foot locked in. That's why your ankle snaps and pops.
Yeah. Well,
There we go.
I broke this ankle. Oh,
There we
I
go.
broke that ankle about 3 times.
Oh, really?
Yeah.
You just never healed from the first time.
No.
Let's do a little cross fiber on here, on the Achilles tendon. And then this will wrap down, the popliteus will wrap down, hook into the inside. I'm not going to touch that right now. I'm just going to do this one. We'll do the popliteus separate.
Is that when you were running?
Yeah. Yeah, and then I got to about, that was distance. But when I used to run like the 400, I used to have to ice my ankles before I ran.
Notice the difference?
Oh yeah.
So the quad, the DrScott is doing a lot of the work for your knee.
Okay.
Okay? When you bend, there's nowhere for the fluid to go.
Right.
So a slight bend is okay in the knee when you're up and around, moving around. It can't have a full flexion in it.
No.
Then when you try to
Yeah,
straighten
and then
it,
when
dead
you do
line.
that, it hurts really bad on the inside.
Just now?
Yeah.
Okay. Let's do it again. Go ahead and do it.
Ah.
Okay, turn loose. I'm going to go upward on this one. Do it again.
That
Better?
doesn't hurt. Yeah.
Okay, so I have to grab the whole edge of the sartorius, semimembranosus. It's a portion of the hamstring. I grab it and I shove it forward into contraction. That's not so bad. Now pull. Good?
Yeah.
And I have to hold. I'm giving a resistance with my arm. Go ahead and pull. Excellent. Let's make that a little better. What we're going to do is put a pad underneath here, underneath the kneecap, and that should help. And we're going to put this on the thigh. So we're going to let the thigh down, up a little more. Down. Now I'm going to be supporting that whole area of the quadriceps right here. So the kneecap will be free to move. Okay?
Okay.
I'm going to grab the the hamstring group. I'm going to hold that down. Go ahead and pull against me. Dig, dig, dig. That feels good. Look at that. You told me you had a bad knee. Pretty good knee. Good job. Now go ahead and just do a few pumps like that. Go ahead and we're going to go through it. All the way up, all the way up. Up, 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 and good. Now it's not going to be a clean motion. Go again. See how it gets shaky? Muscle doesn't know what to do. Do it again. It's real shaky. Go again. And relax. Go again. Come on. Excellent. Go again. Go, 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 go. Just keep pumping. Just keep pumping. Excellent. Turn loose. How's that?
Better.
Not bad, huh? Swollen. Lots of swelling. That, doing this hamstring here, helped this. This went down. So the activity on the hamstring here, on the medial aspect, helped the swelling here. Then the calf muscle should be pretty good. Sensitive?
A little tender.
More through the midsection?
Yeah.
Okay. I'm going to take midsection, going to go to the opposite side. There it is, way over here. I'm just doing cross fiber. I'm doing the opposite side because this crisscrosses, so I'm doing the opposite side. Okay, how are we doing? Good.
Yeah.
Kind of cool, huh?
Mm-hmm.
Now, that hamstring is going to go all the way up into the outside of the buttock, so that's going to aggravate it.
Right.
If I come into the piriformis, bend the knee, bring it way over. Is that on the inside?
Yeah.
Is it gone?
It is now, yeah.
Okay, so it's in the motion, so there's no stability. So I want you to hold it really tight. Keep it really isometric. Now bring it over. Should be fine.
Yeah, it is.
Yeah, you can't be loose. You're gonna have to just protect every single motion. Good. Now, in that position, you can actually do that as an exercise.
Okay.
So it'd be heel to buttock and over. Now you're gonna keep the whole leg tight like an isometric. Yes. And then out, and down, and come back. Yes. Like that. Now if I was gonna give you resistance, you'll feel what it's like. Got it?
Mm-hmm.
Okay, now you just do it without just the weight of the leg. Should be okay. Okay?
Mm-hmm.
Good.
Oh.
So here, comes around to the piriformis. Should be pretty jumpy right about there.
Mm-hmm.
Okay? So that's pretty common with the knee. So I want you to bring this over. Just like that. Don't let me move your leg. Don't let me move it. And it should feel better with a little pressure now. Correct?
Mm-hmm.
Okay, let it go. And it should come right back again. Because this muscle holds our knees.
Mm-hmm.
It's one of the primaries. That's why the hacky sack works so good. Pull the knee out. Pull against me. Okay?
Mm-hmm.
Okay, that's what I should do. This is incredibly swollen. Because of this area right here, it might be a little hard to tape because ideally we'd tape it from below the knee up to about here. And you have enough swelling, I don't think that's gonna be super comfortable right now.
Yeah.
Let's just get a wrap.
Okay.
Let's get a CVS wrap. Just anything. There we go. There, you felt that loosen up. You feel that?
Oh, yeah.
That was cool. I just let go. See how that's all puffy? Old swelling. Heel. Good.
Mm-hmm.
I'm going to do the sulcus on the bottom of the knee. I'm going to get in between the kneecap and the bone on the knee, on the femur, and there's a little groove. So it's called the sulcus, and the kneecap has to run through there. Well, it tends to swell, it has nowhere to go. So we're gonna use a little massage cream on here and open it up. Okay, underneath the kneecap, turn loose, all the way. There we go. And I'm just on the kneecap behind. It goes right into a groove. When you go north, you feel it go right in a hole. Feel it right there? Where my finger dips in? Right there. Yeah, her kneecap is a lot clicking. So I'll do an outside strip then. And I have the quad being stretched with the towel roll here. I've rolled up the towel, stuck it underneath. So it gets a little more stretch. How's that?
Better.
Isn't that cool? Yeah, you got a lot of swelling in this guy. All right, let's do this side.
Where I felt the popping out was definitely on the outside. When I did the slide into home plate with my knee bent back behind me.
And that will take place. This is a safety valve, the fibular head. It's designed to blow out like on a steam, pressure cooker.
Right.
It gives up on purpose. That's not bad. That's not bad. Not at all. So we moved some fluid around so this burst on the outside is not so bad. Yeah, there we go. There it went. Look at that. Just push it right on out. That feels good. All right, let's flip over your back. We're gonna do your kneecap now.
Oh, wow, what a difference. Big time difference.
You're gonna have to protect your bend. That toe's gotta stay forward. Yeah, you can't. Yep, gunslinger style.
Yeah. That makes a big difference right there.
Yeah.
Before I couldn't even do that. I couldn't even.
Cool work, huh?
Yeah, I couldn't even hardly even bend my leg.
That's Dr. Logan.
Oh, that feels so much better.
Who's Dr. Logan?
Dr. Logan was my mentor.
Wow, what a difference.
He took me from
It's still
zero to hero.
Yeah, it's still got tenderness
Of course
as far
it
as the bend.
There's 13 bags of fluid in that knee.
Really?
13 bursts, and they're all talking to each other.
And they're all saying, "Help me, help me." Yeah, wow.
Now, ideally, you want to elevate that leg now way up in the air.
Okay,
Leave
so
it
I'll
up
just
there
lay
20 minutes.
in bed like,
Yes, yes.
Okay.
Putting the leg out straight does not elevate.
No,
It's got to be up.
it's got to be way up. Well, I used to do it so it was at least raised up above my head, but I don't think that's going to get
It's not
the
gonna
ring
get
it
it,
needs. Okay. Okay,
Perfect.
thank you very much.
Nicely done.
Thank you.
I'm not going to tape that one. There's too much swelling.
Yeah,
I don't. I'd let that settle down. I'd rather just do a wrap.
Oh wow, what a difference. Big time difference.
You're gonna have to protect your bend. That toe's gotta stay forward. Yeah, you can't. Yep, gunslinger style.
Yeah, that makes a big difference right there.
Yeah.
Before I couldn't even do that. I couldn't even.
Cool work, huh?
Yeah, I couldn't even hardly even bend my leg.
That's Dr. Logan.
Oh, that feels so much better.
Who's Dr. Logan?
Dr. Logan was my mentor.
Wow, what a difference.
He took me from
Still
zero to hero.
Yeah, it's still got tenderness
Of course
as far
it
as the bend.
There's 13 bags of fluid in that knee.
Really?
13 bursts, and they're all talking to each other.
And they're all saying, "Help me, help me." Yeah, wow.
Now, ideally, you want to elevate that leg now, way up in the air.
Okay,
Leave
so
it
I'll just
there 20 minutes.
lay in bed like,
Yes, yes.
Okay.
Putting the leg out straight does not elevate.
No,
It's got to be up.
it's got to be way up. Well, I used to do it so it was at least raised up above my head, but I don't think that's going to get the
not gonna
drain
get
it
it,
needs. Okay. Okay,
Perfect.
thank you very much.
Nicely done.
Thank you.
I'm not going to tape that one. There's too much swelling.
Yeah,
I don't. I'd let that settle down. I'd rather just do a wrap